Hi, everyone. Welcome to Family Matters. We are so excited to have you join us today. For this episode, we are joined by Lynn Young.
Hi, everyone.
She's the Vice President of Operations at Black Health Tools. Welcome, Lynn. We're glad to have you.
Thank you. Thanks for having me.
This is a very important topic because I think it's something that not many people know about or understand about. So I'm really excited to jump in and get started. So, my first question is, what does the term health literacy mean? Can you tell us in a definition?
Sure. I think sometimes we assume that our loved ones and the folks that we partner with and support understand health information as it's being presented to them, but that's not always the case. So, health literacy is really a new movement that is requiring both the practitioner and, let's say, the patient to come to the interaction and to really make sure that they are able to access health information adequately, that they can understand the information that's presented, and most importantly, that they're able to actually use that information to promote and maintain their health. So it's not just, hearing it, it's being able to kind of take that information and use it in a meaningful way. So if we break that definition down into those three pieces, the access, the understanding, and the using of the information, we really need to think about, can our loved one access the care that they need? Our United States healthcare system is challenging. It's hard to turn over your health insurance card and call the 1-800 number and find people in your network. You might be looking for a specialist. How do we find the, excuse me, the information we need to access care? And then once we find the care, can we access information about our benefits, our copays? All that information is so critical to being able to get to those appointments with healthcare practitioners. And even if they can get those appointments, do they have the skill set or the access to get to the appointment? Can they find a ride? Do they have transportation available? Are they able to manage time and plan accordingly to get to appointments? When we think about the second step, the understanding of the information, this can be a little tricky. Information comes at people in all different ways. It might be over the phone with results from maybe their primary care physician about a test that they had completed. It could be one-on-one in an office visit with a specialist. It could even be coming via print, right? Sometimes we get instructions for how to manage, a procedure or discharge instructions, or we make it an insert at our pharmacy that tells us about a new medication that we're taking. So when we think about understanding the information that's coming at us, it can come from various sources. And it could be very basic or it could be very complex. I think about in my own healthcare journey, having a routine screening like a colonoscopy where you're getting all of this information, what you need to do 7 days ahead of the procedure, 2 to 3 days ahead of the procedure, how to manage the prep that you need to take, your expectations. You need to bring someone with you. You're not allowed to drive yourself home. That's a lot of information to really understand. So, not only accessing and understanding, but using the information in a meaningful way is really critical. So, if we can't understand it, we can't really use it. So, health literacy is really incorporating all three of those pieces.
And you mentioned there's so many steps now in navigating our healthcare. There's trying to figure out how to go onto the online portal and use your email to log in and logging in online. So there's so many steps and skills that are not just second nature to a lot of people. So they really do have to understand it to be able to use it. So that brings me to the next question is what skills are required, that can impact health literacy? What skills are needed to be able to use these skills?
I love the example that you just provided. Technology skills are now part of the healthcare system, right? You mentioned, being able to check into your appointment. Sometimes you receive a text message as a reminder instead of a phone call. You may get your results online through like a My Chart, or if your provider has their own documentation system. So technology skills can even be a barrier for some folks. When we think about adults and older adults, hearing and vision impairment are pretty common in older adults. Lots of folks use hearing aids. They may need glasses. So just making sure that those are in place while we're participating in healthcare conversations can be important. Some folks have comprehension deficits. They may not be able to integrate complex, medical speak, big vocabulary words. They may not understand what that information means, and they may not be able to keep up with the speed of the information. So sometimes we need to ask healthcare practitioners, could you repeat that? Could you slow down and explain that again? Could you give me an example? Just to make sure that we're understanding everything. I think about sometimes when someone's at an appointment with a healthcare practitioner, they may not be getting great news. It may be, hey, your numbers look, worse than last time, or there's a new medical condition we need to manage. And people can react to that in an emotional way. And while they're busy, thinking about, oh, what does this mean for my health? That healthcare practitioner is still providing information, they may miss it. So it's hard when you're overwhelmed or distracted in the encounter to process important information. On the flip side, we may also have to express ourselves in an appointment. If somebody has difficulty doing that, maybe they have trouble finding the words, or maybe they have difficulty being heard if there's loud noise or distraction in the room. So, do they feel comfortable expressing themselves? Can they ask good questions? Can they, stop that interaction and make sure that they're able to ask a follow-up question? We also expect people to be able to have, adequate reading and writing skills, and not just reading basic information, but reading kind of high level content. So if you've ever kind of opened up that pharmacy insert that came with your medication, there's a ton of information on there that's really high level. So if your trouble, or your loved one has issues with reading comprehension, even just seeing the text, they may have a hard time understanding some information that they're receiving. And they may also have to interpret numbers, right? Sometimes people are providing numbers to you. Oh, let me talk about your blood work numbers, your cholesterol numbers. They're presenting pros and cons in the form of numbers, oh, well, 90% of people benefit from this procedure. Or, here's a graph that shows what to expect over time. That can be tough to really understand numeric information for some folks. The other thing is writing, right? We're always asked to fill out medical forms, medical histories. So we want to make sure those forms are understood, both to read what's on there and to understand what you're signing, but also to be able to fill it out and complete it for the healthcare professional. Finally, I'll say we need to think about cognitive skills. And when I say cognitive skills, I mean all of those skills that help people to manage day-to-day life. So things like paying attention, being able to attend to the interaction, being able to take all that information in and sort through it and organize it in some way, right? If you're in an appointment and someone is writing you scripts and they're saying, this is the script I want you to follow up with cardiology, and this is the script for your new medication, you need to get this filled, and here's another script I want you to follow up with a physical therapist. We have to organize all of that and be able to take that home and follow up in a meaningful way. And then when we think about memory, just can we remember what we learned in that appointment? Can we take that information back to our family members or our loved ones and talk it through and share what we've learned so that we can make good decisions? So there really are a lot of skills necessary for health literacy. It's more than just, being able to read a pamphlet or follow instructions. You really have to pull all of it together and think really critically about the information you're receiving.
Yeah, I think the thinking critically component is so crucial because like, for example, my dog had surgery and I got sent with two medications, and one medication was to take every 8 to 12 hours, half of a tablet. One medication was to take every 24 hours, either a fourth to a full tablet. So there's a lot of information. And so I have to make my decision on, as her caregiver of what to give her. So that's just one example, but you really need to, be able to think critically. So can you give us some other examples about how these underlying cognitive skills are really necessary to help a person think critically?
Sure. So, if we're expecting folks to access and use information that they've understood, we know that that could show up in different ways. So, thinking about older adults, they often have multiple medical conditions. So, they are simultaneously managing several things. They may have issues with their vision, on top of the fact that maybe they have diabetes and they're managing their insulin. They may also have balance issues and they may be high risk for falls. Maybe they've fallen in the past. So these are all different conditions that they need to sort of be tracking and keeping an eye on throughout the day, throughout the week, throughout the course of their life. They may also have different experts on their healthcare team, right? They may have different specialists that they see routinely that give recommendations, make suggestions. They're pulling in all of this different information and they have to integrate that into what they're already doing. What's their normal routine? What do they do already? And how do I pull all this new information in? So, if somebody takes multiple medications and now they have some new medications that they have to add into the mix, they have to be aware of that. And there may be interactions with other medications. So, they have to be able to provide that information to their doctor at the beginning. And they have to be able to integrate that into their routine. Maybe they only take medications in the morning and the new meds are for the evening. So, that's going to change up their routine. Maybe they have to make dietary changes that one of their physicians or multiple physicians are recommending for their health. So now they have to grocery shop differently, meal prep differently. They have to work with who lives in the household. Maybe someone in the household is allowed to have something, but they're not. So we're pulling in all of this information and integrating it into our daily routines. And change is hard, right? It's difficult sometimes to do new things. We may be recommended that we need to walk more, we need to exercise or do, back exercises or knee exercises, and that's not part of someone's routine. If you layer on top of that what we talked about with those cognitive impairments, it can be a real challenge. So if somebody has those attention deficits, let's say, or even a hearing impairment, they may have missed key information at the appointment, or they may have missed the test results. So they're working with maybe half of the adequate information that they need to manage their health. If someone has those organization and planning issues, they may have a hard time changing their schedule, reorganizing how their morning routine looks, or being able to change up or add in new things into the day. And then the memory deficits that we mentioned, just remembering what am I supposed to be doing? I'm not supposed to use salt at a meal. So every time I sit down, breakfast, lunch, and dinner, I want to go to that salt shaker because that's what I always do, but I have to remember not to do that. Or when I'm in the grocery store, I have to remember, I'm increasing my fiber or I'm getting more protein in my diet. So I have to remember to add those things to the list so those items come home with me so I can then remember to take them or integrate them into meals. So it can be a real challenge if there are these cognitive issues on top of pulling all the health information together.
You just brought up the memory. It seems to me that, memory is the thing that most people can relate to. Either some people have just a little bit of memory deficits, or maybe they just occasionally forget someone's name. And then there's those folks who have more uh, cognitive deficits, primarily with memory. So, how does the memory issues with the older adults, how does that negatively impact health literacy?
Yeah, it's a great question. I think we could break this up into sort of two camps. There are the folks that are unaware that they have a memory issue. So that can be its own challenge because if you know you're struggling, you can take action to support and enhance what you're able to remember. And we'll talk a little bit about that. But if you're unaware that you have a memory issue or you're in denial about a memory issue, you may be operating under the assumption that you did receive all the information, and that can put your health at risk if you're not following recommendations, if you didn't make the follow-up appointments as necessary, if you didn't go get that blood work, if you didn't have that procedure scheduled, you can put yourself at risk in that way. If you can't remember what symptoms to be on the lookout for, to recognize when to call back at your doctor's office, you could actually be putting yourself in jeopardy for your health. If you're aware that you have a memory deficit or your family is aware, you want to build some things around that person to help them be more successful. So we know we talked about medication, just as simple as getting a new medication, being able to remember that is really critical. If you can use compensatory strategies, signage, reminders, maybe someone's helping set up your pills, you're less likely to have an error with the dosing, miss a dose, or have side effects from your medications because you didn't take them in the way they were intended. So when we think about folks that do have memory impairment, having that insight is really important, building that insight and making sure someone understands, I may not have gotten all the information, makes them more willing to use the strategies. So some strategies that could work, if someone is kind of flying solo at appointments, doesn't have a family member to go with them, that would be great. If we could take someone with us, we have another set of ears. We have someone else who heard the information, someone else who can help. But if we're going at it by ourselves, we might want to practice with that person how they're going to manage in the appointment. So know how much is too much, right? Some people are good for short periods of time, but if it starts to go on too long, the information's too complicated, they start to struggle. So stopping people and verifying what they heard. So what I'm hearing you say is this new medication needs to be taken with food. Is that correct? Right? Just something that simple stops the flow of information and allows them to ask some questions to verify that they understood it, and that will help them to remember. Note taking is another great skill. So, having a little notebook on you to jot down key points, any details, any, follow-ups, and then you can read it back, and just say, this is a lot of information. I'm just going to jot some of this down. And then at the end, I want to run this back, past you to make sure I didn't miss anything. So that will allow you to have the information for later, as well as verify that you got everything in the appointment. And some people even use the notes feature on their phone. So there's different ways to jot things down. You can even ask the healthcare practitioner if they have this written down already. Hey, you're talking to me about checking my feet and my skin because I have diabetes and skin breakdown is a risk. Do you have any written information on this that I could read about and reference at home? Asking if they have handouts or other materials might be helpful just to give you some information that you don't have to necessarily jot down, but that you can look at later.
So even if there's cognitive deficits, if someone has, some kind of impairments or memory impairments, they still can use these compensatory strategies so that way their health literacy is more adequate. So in speaking of terms of adequate health literacy skills, how does this benefit the person and their families?
Yeah, it's a great question. We want people to have good health literacy because that allows them to make informed healthcare decisions. Knowledge is power, and the more you understand your health condition, the more you can prepare, right? The more you can go into situations knowing what might be a risk for you. You might recognize symptoms if they pop up. You want to know, when do I need to seek, my healthcare professional's advice? I think a lot about during COVID, we were being provided health literacy information as we were learning more about COVID. First, it was, stay home, avoid people. That's the safest choice. As we evolved, we learned that if you can wear a mask, that can help protect you. So that was another piece of health literacy information. Wearing a mask is a preventative. Staying 6 feet apart, washing your hands, right? All of these things we started to learn were health literacy information. It was the knowledge about how to navigate COVID successfully, how to be safe. So, good health literacy skills are going to improve your current health, but they can also improve your health long term, which can impact your longevity, right? Your ability to live your life in a way that you are healthy for as long as possible. So, it's really critical that we ensure, ourselves and our loved ones have these adequate skills to take in healthcare information. It can be a matter of life and death in some cases.
Are are there any things or tools or strategies that a loved one could do to help with health literacy? I know you mentioned going to an appointment, and I know you mentioned some other strategies. So, are there any other tips that you can provide that the family members can help?
Sure. So just being aware of what are sort of the basic expectations that someone needs, what skills do they need to navigate the health system? If you're seeing a loved one struggle with the access piece, they don't understand their benefits, they're not able to make appointments, they're not able to follow up and attend appointments, you may need to step in and work on that and help deliver the information to them or be available to help them navigate the healthcare system. If they're able to navigate and they're able to get to the appointments, but they're coming back with, I don't really know what they said, I don't understand a thing that they were saying, then we need to make sure they're more successful when they go to appointments and that they can take that information and use it. So if somebody is struggling, we may need to do a practice session with them, right? We may need to help them prepare for their appointments. That could mean looking up information together to learn about their health condition. It could be discussing, the details, the symptoms, the treatments, so that you're more familiar with the vocabulary and what might be covered at the appointment. It also allows the patient who's meeting with the doctor to be prepared, to maybe bring some questions to the appointment, to think about, am I having any symptoms that I want to talk about? Maybe talking through the symptom list and saying, here are the side effects to that new medication. Let's run through them. Are you having any? Are you feeling dizzy? Yes or no? Are you feeling more tired? Are you having any of these headaches that they mention? So they can bring that to the appointment. So kind of set them up for success. We can also help them integrate any changes in their health right into their daily routine. If somebody's being asked to change their diet, it can be really challenging if everyone else at the table at Thanksgiving is able to partake in all the things and they're not. So maybe we can change up, what's served at holidays. We could provide some recipes. Help that, we're going out to lunch or dinner, help them look at the menu. Hey, it looks like this would be safe for you to have. This looks like a good choice. So reinforcing recommendations from the physician to help them make those changes. And then, ultimately, if someone can go to an appointment, that's great. But if they're not able to, maybe they could even just role play and practice with their loved one so they are prepared when they go by themselves.
Yeah, that's really great information. Okay, we only have time for one more question. So I'm wondering if you could point out some red flags that families can kind of be aware of if their loved one is presenting with any health literacy issues, just so they can, pinpoint what's going on and hopefully try to help provide some strategies.
Yep. Unfortunately, there's a lot of red flags. There's a lot of folks out there that don't seek, their healthcare professional for a multitude of reasons. Maybe they've had a bad experience in the past. Maybe they don't think there's value in attending appointments or having routine screenings. So, right up front, just the complete refusal to participate with their healthcare practitioner. Similarly, people who say things like, oh, I'm fine, or that's a waste of time, or I don't have to follow those recommendations. I've been doing it my way. Those can be red flags. Anyone who goes to an appointment and doesn't say anything or doesn't ask any questions or isn't able to come back with information may be someone who really didn't understand what was being presented. If you don't understand what they're saying, it's hard to formulate follow-up questions because you're just trying to kind of decode all of the medical terminology. So if they're coming back appointment after appointment saying, I didn't really understand what they said, or I only got this one point, they went on and on for 20 minutes, but all I took away was this, that could be a red flag. If they're telling you or you're noticing that they're really hard of hearing or they can't process the information in the appointment, they keep asking them to repeat, they may be struggling to understand the content as it's coming at them. If they're kind of visibly distracted, right? If their attention span is short and the doctor is explaining something, different surgical options for a procedure, low, moderate, and high risk, again, all the benefits and all the pros and cons. And you just kind of see them glaze over. They really kind of zoned out. They couldn't pay attention. That could be a red flag. And then folks that don't know their medical history, if someone says, what medications are you taking? And they say, I don't remember. Well, when's the last time you saw your primary care doctor? I don't know. Have you been in the hospital at all? Not sure. Memory could be a real issue for them. So, and it stands to reason if they're not attending and they're not understanding, they're probably not using the information in a meaningful way to promote their own health. So I'd be on the lookout for those types of things just to be on the safe side and just kind of checking in. Hey, I know you were supposed to be, lowering your salt intake. How's that going? If they say, what are you talking about? They probably aren't doing it. If they're able to communicate to you, oh, I made these changes, that would be a good sign that they're integrating the information. So I think just good communication, observation skills, and checking in are kind of your best practices.
Lynn, thank you so much for taking the time to share with our families on this very important topic. I am sure that the families will value this topic and value the information you provided. Thank you, everyone, for joining us, and stay tuned for our next Family Matters episode.
Thank you.
Bye-bye.
Thanks for having me.